Hi everyone, welcome back to Breathe Easy, and I wanted to share some helpful insight. This month's Inpatient Skin and Wound Education rounding focuses on preventing pressure injuries related to pulse oximetry. Whether you realize it or not, it does get counted as a respiratory care device. So pulse oximeters are small, familiar devices to us, and they can absolutely contribute to skin breakdown if we're not intentional with our placement, assessment, and then the nursing rotation. Today we'll walk through the types of pulse oxes used across our inpatient areas, proper application, and nursing has a required assessment frequency and their own documentation expectations. This education aligns with our inpatient skin and wound standards and helps support pressure injury prevention across ECU Health. Let's get started. So let's begin with the adult pulse oximetry sensors. The first is the fold-over plastic sensor, and this sensor is intended for adult patients with over 30 kilograms and is single patient use. The graphics imprinted directly on the sensor help guide proper placement. When applying the sensor, place it on the finger or toe, making sure the sensor indicator is positioned on a fleshy aspect of the digit. The second option is the wraparound NIA sensor, and this also is for adult patients, typically over 40 kilograms, and is single patient use. One advantage of this sensor is that it's easily removed and reapplied, and the replacement tape is available if needed. It is important to remember that this sensor is not recommended for use on the ears. Next is a trauma sensor. This sensor is used for adult patients over 30 kilograms and is also single patient use. Application is similar to other adult sensors. Place it on the finger, ensuring the sensor is positioned on the fleshy aspect of the digit. Even though the sensor may be used in higher acuity or trauma situations, skin assessment and rotation expectations with nursing still apply. Now let's talk about site care and assessment, which is one of the most important parts of pressure injury prevention. For adult finger or toe sensors, the skin should be inspected and rotated about every 12 hours. This means from a respiratory care perspective, we need to discuss with our nursing partners if we're going to be rotating this. A new sensor isn't required when rotating to the new site, and ear placement is not recommended, but if it is used, the sensor must be removed and the site rotated every 2 hours due to increased risk for skin breakdown. If you notice the adhesive is not sticking well, you can gently dab the skin with an alcohol wipe, remove the adhesive strip, and apply a new adhesive. When moving a sensor, always disconnect the sensor from the monitor cable first, and then remove it from the patient, reapply to the new site, and then reconnect the monitor. In some situations, specialty sensors are more appropriate. The forehead sensor item is approved for adult patients over 10 kilograms. It's a single patient use and applied above the eyebrow secured with the headband. Forehead sensors require skin assessment about every 2 hours, and the sensor should be removed, the skin assessed, and the site rotated in the different area on the forehead. These sensors may remain in place up to 12 hours, but the site should be checked frequently for circulation, adhesion, and/or correct optimal alignment. The ear clip sensor is for adult patients over 30 kilograms and is also single patient use. Ear clip sensors require hourly skin assessment. This sensor should be removed and rotated to the opposite ear, and it's important to remember these sensors are not intended for prolonged monitoring. To reduce pressure risk, avoid positioning the patient's head toward the same side as the sensor. Proper placement matters. Sensors should be applied so that the line emitting and receiving components are directly aligned over well-perfused tissue. Avoid placing sensors over bony prominences, tight joints, or areas of poor circulation. Incorrect placement can not only increase the risk for injury, but also lead to inaccurate readings when in doubt, and reassess placement and rotate the site. For infant and pediatric patients, sensor selection is weight-based. Infant sensors are used for patients 3 to 20 kilograms, pediatric sensor for 10 to 50 kilograms, and NIA sensors for patients under 3 kilograms. Infant and pediatric sensors are applied to the finger or toe, while neonatal sensors are applied to the hand or foot. Regardless of the age, the skin should be inspected and the sensor rotated every 12 hours to prevent tissue injuries. Typically, nursing documents the site here at our facility at the medical center. It may be different in your location. Just know that if you do end up changing the site at all, you do need to have that conversation with our nursing colleagues. If you'd like more information, additional resources are available on the Inpatient Skin and Wound intranet page. The Device Care Management Guide Policy, and the Pulse Ox Use and Documentation Tip Sheet. You can also review educational materials through Learn Center modules and MASIMA educational resources linked in this presentation. Thanks for taking the time to review this education and for your continued commitment to patient safety. Small devices make a big difference when we use them thoughtfully. Thank you for listening to this week's Breathe Easy podcast update.